where I grew up, anxiety wasn't something that we really talked about.
Yeah.
It was kind of, if you're really anxious or nervous, just try to manage it, sort of stuff it down. And if it's so bad that you can't suppress it, then we'll take you to a doctor. And the doctor will give you a medication like an antidepressant or benzodiazepine, or they'll send you to talk therapy. And many of us have had that experience where it's just not enough, or the anxiety finds other ways to come out.
For those of you that don't understand Dr. Nicole's work and Panic Proof, it's a holistic solution to anxiety. And one of the things that I really appreciate, that I really want to dive into deeper throughout this conversation, is something that you've said, which is that anxiety is just the label. It's really just the tip of the iceberg. It's the word that we use that is so common. And we're going to go through the differences about men and women, because anxiety impacts women more aggressively and in more numbers than men. But just backing up, I mean, anxiety is really a signal of something deeper going on, right? And I mean, that's the key of what you're saying here, is that the tricky thing about this is that this word gets thrown around so much, and almost in a bad sense, culturally praised or glorified. It becomes this identity that a lot of women and men are saying, I'm anxious, I have anxiety. What does that really mean when someone says anxiety, and how do you get to the root cause of the anxiety?
That question was jam-packed with so much goodness there. I'm thinking about a story that changed my life, about how I look at the way that we label and identify with the symptoms that we experience. And I kind of want to start with a story, and then maybe we could go from there, because I feel like stories are so important for the human, and stories can encapsulate so much richness. And my mentor told me this story when I was in medical school about how in his practice, many years back, he had a really precise focus on autoimmunity, in particular, lupus in women. And so these women would go in and he would treat them using homeopathic, naturopathic, holistic methods. And by and large, they had really good results. And so one year, these two women came in, and they weren't at all related to each other. They didn't know each other. It was kind of a coincidence. They came in and established care around the same time. Similar symptoms, similar blood work. And he was thinking to himself, well, this will be a really cool case study just to see how this progresses. And one of the women is thriving. She's getting so much better. Her face rash that often will present with lupus, it went away. Her blood markers got better. Her gut got better. Her immune system got better. She was just rocking and rolling. And he's like, yeah, this is great. This is what you expect. But the other woman wasn't. She wasn't making hardly any progress at all. And he couldn't figure out why. And he's racking his brain and trying to think of, is there something I'm missing? And that's often the case for many of us, is when we're not getting results. It's not that we can't heal. It's just that there's a bit of data that we haven't quite found yet. So we got to be more curious and keep looking. So he did. He kept looking. And then one day he found it. And you'll never guess what he found. Is he brought her to walk her out. It was her visit, and she was the last patient. So he's standing at the door and he's locking up. He sees her go to her car. She gets in the car and backs out of the parking spot. And this is the moment that changes everything. On her license plate, it says lupus me. And this invited a conversation between my mentor and that woman about what it meant to her to be diagnosed with lupus, to be a lupus warrior, to be a lupus sufferer. And it wasn't until they started doing that work, and she did a lot of really powerful EMDR and counseling that works with the mind and the body, that her autoimmunity, the label that she was given, she started to get better. And we see this with panic and anxiety, is that there is a placebo phenomenon where a blank pill or nothing can cause a positive change. And we also see a nocebo, where something can stop us from responding positively. It can be an obstacle. And so I love that first question that you asked there. Well, what does it mean? What do these labels mean? And for those who are listening, is allow yourself to notice your lived experience and notice how categorically it could be called anxiety, but also remember that it's just a label.
Yeah.
And that your anxiety is your unique way of healing.
Yeah. And it really has so much to do generally with our experiences, right? Our background, our experiences, childhood trauma, all of these different things. I think one of the unfortunate realities of traditional medicine and how anxiety is treated today, and you're the expert here, you can tell me, but from everything we know, patient goes into the doctor, you have anxiety, here's an SSRI, and then they're on that, for the foreseeable future, sometimes decades, sometimes more. They're really hard to get off, which we'll talk about. So what is your approach? Someone comes in to see you, what should we be doing instead of just saying, here's your label, here's your identity, if you will, here's a drug for your identity. What other options do we have, and how should we be looking at something like anxiety? Because clearly, as you know, your experience and your background, this is serious. People can die from these types of, panic attacks and anxiety. It's a very serious thing, not to make light of, but also not to just write off, here's a prescription and we'll see you next year.
I honor that. And that was my story, as I was given an antidepressant and I was on it for decades, and it helped me kind of zombie out a little bit, but then there were trade-offs. I gained weight. I had no libido. It wasn't a sustainable long-term solution for me. I'm grateful for that, for where I was. But for those who that is a part of your story, is think of that as a flotation device that helps you stay afloat in the water while you're learning the strokes to swim. And then maybe you'll take them off and you'll be able to be medication free. Maybe not, but allow that to be the semicolon as opposed to the period at the end of your story. And where we begin is to redefine anxiety, fear, and panic, and to then start targeting fear of the fear. So the first thing is fear. Fear is a totally natural, amazing biological response that protects you from danger. Thank goodness you can have a fear response. Your ancestors who had fear responses, there's a tiger prowling in the woods, those that were able to be afraid and respond survived and had descendants, including you. And when you're in true danger, you want fear to help you fight, flight, freeze, flop, fawn, or fracture.
Yep.
Anxiety is when we have that fear response outside of the context of actual danger. So you're driving down the highway and you have a panic attack, or you're about to do a presentation at work and you have anxiety, or you're just trying to take care of your job. You're getting emails and you feel like you just want to curl in the fetal position and shut the door and turn off the lights. So we experience this physical response, these mental thoughts outside of actual true danger. And so then we ask the next question that you so wisely pointed out is, well, what is this? Why is this happening? What is this an adaptation to?
Right.
And the metaphor that I want people to think about when they're asking the why question is all about, what am I adapting to or coping from or coping with? Think about it like a winter coat. Like right now during this conversation, I'm in Michigan and it's like 17 degrees outside. I cope with this. I survive this by putting on a warm coat and lots of layers. And that keeps me from getting hypothermia. And when I go to Arizona and I winter in Arizona on Friday, I'm going to continue to adapt to the change in the climate, where now it's going to be 75 and sunny, where if I keep that old adaptation on, if I keep that coat on, I might actually overheat and have symptoms and suffer. So when we look at anxiety, is we want to ask questions about what is this an adaptation to? What did or did not happen to me in my history, in my life, and what is or is not happening to me in my presence right now? And then we can look out from there and think about it like a domino, where if I have an early childhood event that's really stressful or scary, my body's going to try to put on that coat. And so my hormones will change. My gut microbiome will change. My behaviors, my feelings, my immune system will change. And so now we have a much more robust place to start with versus talking about it in talk therapy in an antidepressant, which really doesn't get to the root of the why.